Okay. Hello, everyone. Welcome to another episode of the MSNS podcast. My name is Ryan Lim. I'm going to be a junior one.
And my name is Toby Lin. I just graduated.
So, yeah,
My name is Soo Young Lee. I'm currently an assistant patient care manager at Stanford Healthcare, and I graduated from University of San Francisco in spring of 2016.
all right. So, yeah, just to, warm things up and start it off, like we always, ask the same question every time to our guests. Why do you choose nursing? And then to add on that, why do you keep nursing as a profession?
I chose nursing because it's kind of like a typical answer as everyone else, but I really wanted to help people. My biggest passion has really been about teaching and just kind of spreading the knowledge to everyone else. And so when I was choosing a profession when I was in high school, I was thinking like I wanted to be a teacher, but I'll be honest with you, teachers don't make a lot of money, right? So, I thought about nursing and how nursing you teach patients and you can teach your coworkers and, you can eventually be a nursing instructor down the line. So I decided to go into nursing, and I realized I really do enjoy nursing because there's that aspect of patient care where you get to be at the bedside and you get to really interact with the patients and you get to know them on a more personal level. Then there's a great sense of teamwork amongst the nurses too, and that's really just what I love. And then that's why I came back to teach at the University of San Francisco as well, so that I can really fulfill that desire of teaching. And really, I think for me, I want to show people and I want to show nursing students how amazing it is to be a nurse and to be that frontline worker that really takes care of other people. And yeah, and that's kind of why I got into nursing, and that's kind of why I'm staying in nursing right now, because there's just a fulfillment that you get in your life knowing that your job is something where you're taking care of other people, and it's something that's so vital to the world, really, and you're giving back to your community.
Mhm. And like, I like that idea that maybe nursing necessarily wasn't what you were going for at the start. Like you kind of sounds like your passion was teaching and nursing as like spread that teaching to everyone else.
Yeah, I mean, if anything, like during nursing school, I was actually thinking about dropping out because I never thought when I was a sophomore too, I didn't think nursing was the right path for me at the time because I burned out so quickly. But I stuck with it. I went through my psych rotation, and it actually ended up being okay.
What got you through that burnout stage in sophomore two? I feel like that is a very crucial semester where you start doing the HESI and things start getting a little bit more intense. Like, how did you get out of that funk? Like,
Yeah, yeah, and that's a really good point, right? Like sophomore two is when it's the most stressful time because that's when you do your HESI, like you said, and it's also I think clinical is when it starts to get really tough, as well as the classes, because a lot of it's med surg too. It's a lot of critical thinking, right? um, and my clinical instructor, that he was really hard on me too, so I really started to kind of doubt myself when it came to nursing. And I think what really got me through that burnout honestly was going through that junior one semester where it's psych and community, where I realized that nursing isn't all about critical thinking. It's not all about like the science behind it, but it's also like the caring and the compassion and like actually taking care of the patients. When you go through psych and community, that's like a main focus
mm,
for nursing, right? And so kind of going through that semester, I realized, oh, you know what, nursing is something I really want to do because I'm very passionate about helping other people. And that's what nursing is all about. And once I started to notice that, I started to really enjoy myself a lot more. And I carried that mentality with me to junior two. And even though junior two is the med surg rotation where it gets really tough, I still kept it going with the fact that I'm here to help patients. I'm here to provide that compassionate care, and the science behind it too. Allows me to be a better patient advocate for my patients too. So that's what kind of kept me going, and that's what helped me kind of enjoy nursing a lot more too.
I feel like actually that caring, compassion, and like advocating for patients, that side of nursing, that was something that I actually didn't really know about until I actually took your class, freshman one,
Hmm.
nursing
Right.
120. It's this weird thing where um like it's like I feel like from that transition from high school to college, I'm super stressed. And I'm like very nervous about, what nursing entails. You hear all these rumors about how hard nursing is, how hard it is. And then I meet you and you're like the coolest teacher ever, honestly. We're like, I remember, we were supposed to have homework or journal prompts or whatever. And you were like, don't mind that nursing school is hard enough as it is. So the journal to serve as like a stress reliever, place where you can talk about anything and everything. And I think you were also one of the first teachers to like help widen my perspective of what nursing entails. You emphasize how nursing is not just a title or a job that involves physical labor. There is a responsibility to educate, advocate, and like connect with your patients. And I feel like something that I've heard a lot about is like a lot of people kind of brush off that nursing 120 class because it's only like once every 2 weeks. It doesn't require too much work compared to all the other classes. But I feel like it's a very meaningful class considering it's like your first real nursing class as a freshman and it's your introduction into the world of nursing. Like, can you maybe describe the importance of your role as a professor in introducing the freshmen to what nursing really entails?
Yeah, sure. So, you know, when I graduated nursing school, and I actually was speaking to my nursing 120 instructor, Dr. Mary Lou Denatale, I told her that when I come back to teach, I would like to teach either nursing 120, sophomore 2 clinical, or senior 2 capstone clinical. And my reasoning for that is because throughout my nursing school career too, nursing 120 was probably, it's your very first nursing class, right? And I had Dr. Denatale, and she was incredible, and she was the one who really opened my eyes to nursing as well. And kind of like what I did for you, Ryan, just kind of showing me like what nursing is really about, and showing me like the different sides of nursing than just the hospital care that most people think about, right? And that's kind of what helped me. Like, I was like, okay, well, maybe nursing is something that I'm actually very interested in. And so, and then the reason why I was thinking about sophomore 2 is because, like I explained to you, that's when I burned out, right? That's when I decided, like, oh man, I don't want to do nursing. And so I wanted to help my students in that semester be like, you know, this nursing is not just about the science part, like I said, like there's more to enjoy than that. But also sophomore 2 is when you start to build a foundation. And if you have a very successful sophomore 2 semester, you're going to have a very successful junior 2 semester as well, because you already have that foundation. And I wanted to make sure that I wanted to create that foundation for my nursing students. And obviously senior 2 capstone is the semester where you start to piece everything together. It's the semester right before you graduate. And that's probably when you're also the most stressed out because you're looking to find a job. And that's why I really wanted to step into that semester as well. And being a nursing professor now, I've actually taught all 3 semesters. And I can tell you that I really do miss teaching nursing 120 for the very reasons that you said, because I feel like nursing 120 is what starts that journey of nursing. And that's where I felt like I learned the most about what nursing is really about as well. And that class really teaches you about the sides of nursing that you've never known before. We talked about cultural competency, we talk about healthcare literature, we talk about what nursing is really about. We talk about the homeless. We talk about psych. We talk about insurance. There's a lot of things that we talk about in that class that's so applicable to nurses that you don't have the time to talk about in your sophomore 2, in your junior 2 rotations. And so I feel very passionate about, showing students, especially like at USF, like you said, a lot of kids are coming through from high school, going first semester into college, not knowing what they want to do, not knowing if nursing is really what they want to do, and to show them that, hey, like this is what nursing is all about. If you like it, then we should continue on the path, and I'll see you later on down the line, sophomore 2, junior 2, senior 2. But after taking this class, if you feel like it doesn't really connect with you, then maybe it's time for a career change. And I can tell you that some of your classmates, when I taught that class, have actually come up to me and said, like, hey, I really appreciate you like taking the time to talk to me about nursing and everything. I just feel like maybe this isn't the right path for me. And actually many students have changed their majors after taking that class, and which is fine, right? But at least they do it freshman 1 rather than senior 1 when they've gone through all of it. So yeah.
And like as I remember, I feel like one thing that stood out in your class was like when you were talking about certain areas of nursing, one that you highlighted was hospice. Maybe because you were working in hospice at the time, right?
Mm-hmm.
Why was hospice? I know I was very interested when you first said that was I don't think I really knew what hospice was. Why was hospice maybe in particular something that you wanted to bring up to the freshmen?
Yeah, I think hospice was a pretty big topic, and Dr. Denatali, who is the creator of the class, put a really big emphasis on hospice as well. I think hospice is one of the most misunderstood parts of nursing. Most people think of hospice as just kind of, end of life and patients are dying and it's sad. But, people don't realize that hospice can sometimes be the happiest moments of anyone's life because that's when you get to really enjoy everything and just really not have to worry about a lot of the things that you have in life. And so a lot of students, they think hospice, they think I can't do that. That's not something I can do. I'm not compassionate enough. I'm not caring enough. But really, what you start to realize is as a nurse, stepping into nursing school was step one in knowing that you can provide that compassionate care and knowing that you can provide that, that like the holding the hands of the patient or speaking with them or listening to them. Um, and so I really want to emphasize that even though you think that you can't do hospice or you can't do a certain part of nursing, you have it within you to do anything you want to do in nursing. Don't think that you can't do anything. Don't think that you can't be an ICU nurse or an emergency room nurse or a hospice nurse or a psych nurse. The fact that you're in nursing school, that's what shows that you're able to do anything that you really set your mind to. And if anything, right, hospice, you're there for someone at the end of their life. Like that, it's probably one of the most honorable things that you can do. That you are the last person to guide them on their journey at the end of their life. We always talk about our parents and how amazing they are for raising us. They're the ones that were there for us at the start of our lives, and they're people that we appreciate for our entire life. Can you imagine being that person at the end of someone's life when they go into the afterlife, whatever they believe in? Then they say, "Oh, I remember Soo Young, and he was my nurse, and he helped me get through the end of my life." And just kind of, to me, it's just like so fulfilling that I was able to bring comfort to someone at a time when most people have moral distress. I was able to make sure that their life went smoothly at the end. So, and I wanted you all to know that, hospice is definitely an option that, anyone can really go into and really, if you want that sense of fulfillment, then it would be a great path to take.
Mhm. And I feel like death is such a, or end of life care and death are like such important topics that need to be brought up in nursing because whether we like it or not, it's gonna we're gonna be exposed to it at one point or another. As much as we want to focus on saving lives, I feel like we're gonna see death, or just like we're gonna see death. But I think one of the reasons why hospice is maybe not necessarily on the radar of many nurses or like nursing students is maybe because of how touchy death is as a subject in society, right? And like I don't know because I took death and dying as a class. I thought it was amazing, but I feel like even if we offer that class of death and dying, sometimes we talk about hospice, palliative care, death in multiple nursing classes. I feel like you agree that still not talked about enough in classes.
Oh, I definitely agree. Like you said, death and dying is something that's a part of nursing, no matter where you go. No matter which floor you end up on, you're always going to experience some death and dying. And I feel like nursing schools do have a difficult time in preparing nursing students for the experience of death and dying. I think USF is very unique in the sense that we do talk about death and dying, even as a freshman. Um, I've spoken to many of my colleagues after I started working, and I talked to them about this death and dying class that you took, and as well as the death and dying that we talk about in our nursing 120. And many of them tell me like, "Oh, I wish I had that in my nursing school. That's something that I wish I learned about," especially because you never know what to do when a patient dies. And as a nurse, you want to be the dependable rock for your patients as well as their family members. But when you don't know what to do, it's hard for you to be that dependable rock, right? And so I personally feel like it needs to be talked about more in nursing school. I know that there were talks at USF making death and dying a required course for nursing students as well. Obviously, that'd be really tough just because of the popularity of the class, as well as, you can't just have anyone teach it. I think the professor,
Yeah.
if it's still Professor Heinerman,
Yeah,
Yeah.
it's still Henneman, yeah.
Yeah, and he's amazing, right? Like he does a great job of
Mhm.
teaching that class. But you can't if you have him teaching multiple classes like that, and nursing students are required to take it, that would probably be the best scenario. But it's just tough, right? In 4 years, you got a lot to go through, and especially with the requirements of taking philosophy, ethics, and theology as well, it's hard to really fit everything in, into nursing school along with all the other classes that you have to take. I'm a pretty firm believer that nursing students should also be taking communication. I know we take public speaking as a general ed, but I think communication is also something that should be talked about. But so obviously death and dying would be hard to fit in as well. But yeah, it is a very important topic, and it definitely should be talked about more often. And I'm glad that we do it in Nursing 120 at the very least.
But like beyond maybe just nerd, do you feel like I know like in general as a society, I think death is a very taboo subject, and I feel maybe goes even earlier on, maybe in high school. So I feel like what I've learned from the design class is that death used to happen in the home. Before back in the day, like especially hundreds of years ago, like where we were more exposed, families were more familiar with the dying process. But I think as hospitals have gotten larger and more sick people start staying in hospitals towards the end of their life, there's like this disconnect between the rest of society and death, which kind of creates that fear like, oh, what's gonna happen at the end of life.
Yeah, and hospitals have done a lot better job of actually sending patients home now for the end of their life. There's been a lot of things done, and I mean, I can really only talk to the Bay Area and kind of what we do at Stanford, but we've teamed up with many hospice agencies in the area to be able to send patients home or be able to send them to a home-like environment instead of staying in the hospital. I think the doctors are receiving more education as well on death and dying and realizing that how important it is to experience the end of life in a more familiar environment and at home. And so instead of admitting patients into the hospital, we're sending patients out to their homes, set up with hospice agencies, straight from the emergency department, rather than being admitted into the hospital. I think one of the toughest parts is, you get admitted to the hospital, you get this agency set up, you get all these things, case management issues set up, and now the patient's too close to death that you're afraid that during transport they're going to pass away. And that's the last thing that you would want. And now that we're speeding up the process and sending them out straight from the emergency department, I think we're seeing a lot more death happen in the home, which is where it should happen. And people are starting to accept it a lot more as well. And especially with our aging population, right? We're starting to see a lot more patients closer to death. But um, and so it's nice that there's a bigger push now for hospice to happen at home.
Yeah. And I think that goes back to what you talked about with why you really came into nursing with education and seeing the difference that education makes with doctors and hospitals and staff, right? With nurses not understanding the death and the dying process, doctors not understanding death and the dying process, how can they really be there in that moment at the end of someone's life? But then the difference with someone understanding the dying process and then being able to maybe catch it sooner, right? Having that conversation of palliative versus hospice care much earlier in a patient's care versus now they're admitted and they're too unstable to even transfer to a place that they should be in.
Right. Yeah. And it's I think Toby, you bring up a pretty good point where the conversation of palliative and hospice should happen much earlier. I think doctors and nurses get caught up in, oh no, we can save this person's life. We need to try everything, and our duty is to save their life. But we don't really ever think about, well, maybe what's best for the patient isn't this aggressive treatment. Like what's the use of doing a surgery on a patient who's 90 years old? And their outcomes can be even poorer. Like, wouldn't you rather have a better quality of life at the end? And it's kind of having that conversation, because some people will tell you, yes, I want to have this surgery, and yes, I want to go through all this, and I don't care if my quality of life will be worse. If there's a chance that I can live longer, I want that. But I can assure you that most people will tell you, I would rather have a much better quality of life at the end of my life than go through this aggressive treatment. And it's kind of, as a healthcare provider, is learning to accept that maybe what's best for the patient isn't aggressive treatment and saving their lives and extending their life, but it's actually more so just kind of improving their quality and also doing what they want. And that's kind of our duty to them as a health provider, is providing them with options and doing what is best for them because they want it, not because we want it.
Yeah, and then also I think also understanding that saving someone's life doesn't necessarily mean prolonging it, and that sometimes, alleviating suffering, alleviating pain, and improving the quality of someone's life, even though it's shorter. 3 months of a good life versus decades for some people on aggressive treatments, and it's decades of suffering that they have to endure, not only themselves, their family, financially, mentally, and just overall. It's just one big strain, and that could have been, shortened. All of that pain and suffering could have been shortened, and you could have given them, 3 good months at the end of their life.
Correct. Correct.
Yeah, but I feel like sometimes like physicians and nurses, even they have a lot of difficulty with bringing up that conversation about end of life care, about hospice, because of how taboo it is. And I'm not, like as much as I'm like, oh, we need to expose everyone to death. I'm not saying that we have to think about death all the time, but I feel like we kind of have to welcome and acknowledge our own mortality and even that of others, to understand it more versus just having that fear of the unknown, fear of bringing up the conversation. And especially I think one point you brought up earlier is that when you talk about what happens at the end of life, I feel like the lessons you learn at the end of life is just how we can live now. And when I think about that, it's like there was a book I read. It was called The Five Invitations. It was made by Frank. What was his name? He was like the founder of the Zen Hospice Project.
Mm-hmm.
And he was talking about he was counting all the patients that he was working with while they were in hospital, while they were at the end of their lives. And these five invitations that he learned about from these patients, what a couple of them include, the idea of don't wait, welcome everything, push away nothing, bring your whole self to the experience. I feel like those are lessons that you don't have to wait until the end of your life to do. I feel like because he learned about it from everybody else's end of life, I feel like those are lessons that we can bring to our life now and use it to enhance our quality of life now.
No, I agree with you totally, Ryan, on that too. And I think for me, having done hospice care for about 3 years has helped me realize too, how valuable life is, right? And just kind of to appreciate everything that you're going through. And you're gonna go through tough times, right? Like everyone goes through tough times. Nobody has a very comfortable life. And it's getting through those tough times and appreciating all the good that happens in your life through all those tough times as well. And to really appreciate the people around you, if anything. I mean, and I use this example a lot, but I think every hospice patient that I've had, we think that they're going to pass away tomorrow, or we think they're going to pass away today. You do it a lot. You kind of know when people are close to the end of their life. And some patients will just hold on for weeks. And I mean weeks. I'm not even kidding when I say weeks. And all it takes is for one person that they're waiting for to show up, like their mother or their sister or their brother or their friend, to show up and come up to them and say, like, I'm so sorry I wasn't here, but thank you for everything, and thank you for what you've done. And it's okay. It's okay for you to go. It's fine. And 5 minutes later they pass, right? And what it's really taught me to is just kind of just all the bad blood you have between somebody else, or all the hate that you have, just put it away, because at the end of your life none of that matters, right? And to really appreciate the ones around you and to love the people around you, and just live your life to the fullest, that you don't have any regrets, and so that you can enjoy everything. And so that at the end of your life, you're not sitting there thinking, I should have done this differently, I should have done that differently. And I think that's the moral distress that so many people at the end of their life run into, that's what they're afraid of, is that they meet the end of their life and they say, I still haven't done this, or I haven't forgiven this person, or I still need to ask for forgiveness, or I need to thank these people. And if you can start that process a lot earlier, then at the end of your life, you have a much better quality of life. And so for me I took that as a learning experience for me to really appreciate everyone around me and to appreciate everything that I'm able to do. And honestly, like even appreciating the fact that I'm able to wake up in the morning, get out of my bed, brush my teeth, drink water on my own, and not have to worry about something else. So definitely, and that's what nursing will do for you too, right? Is you start to appreciate the little things that you're able to do and the little things around you. And that's why it's such a beautiful profession, right? Is that you are able to teach your patients and they learn from you, but you also learn from your patients. And you get patients of all ages, all races, all diversity, everything, right? And you get to learn all these different things if you just take the time to sit and listen to your patients, and understand that they're there as human beings, not just as an illness or not just as a task. So yeah, I mean, I think that's a really good point that you brought up. So thank you for that.
I feel like that's what's so beautiful about seeing, um, rather than seeing death as like the end of life. I think seeing death as like a part of life and incorporating that, exposing yourself and welcoming that idea, I think just makes life more better because you learn to appreciate life that much more. And but I think through everything, all the amazing lessons you learn, like how do you cope with that though? Because because obviously when you're caring for these people in hospice, you develop these attachments, you develop these bonds, but you kind of expect them, or you don't see them die. Like how do you cope with that? How do you kind of prevent yourself from burning out from that?
Yeah, that's actually a really, really good question. And I'll be honest with you, I don't have a very good answer for you because I feel like everyone copes differently. Everyone detaches themselves differently. Some people are really good at, when they're at work and they see their patients, they're there, they're present, you feel like, when you're taking care of that patient, like they're your family member. But then when you step out the door, you forget all about it, right? Some people take it with them to home, and they say, "Oh man, I hope this person's good. I hope this person's okay. I hope so and so's okay." And I think really it's just about and what I kind of told you, Ryan, when we were talking about journals, right? It's about self-reflection, right? And it's kind of finding out about yourself and knowing what your own coping mechanisms are. Because like remember how I mentioned earlier, everyone goes through a tough time. Think about when you went through that tough time, what helped you get through it, and it's kind of the same way. And it's just learning your coping mechanisms as well as your self-care activities so that you'll be able to go through those burnout stages as well as the attachments. And a lot of it is about self-recognition and knowing that, okay, yeah, maybe I am getting a little bit too attached to this patient. And it's being honest with yourself and it's being honest with your coworkers and telling them, hey, I really like this patient and I really want to take care of them, but I feel like if I take care of them again one more day, I don't think I'll be able to sleep at night because I'll be so worried. And it's, it's just having that conversation and so stepping away from it and knowing when to step away from it. As a professional, that's something that you need to be able to do and know how to do. And that's something that you learn how to do as you go through your career. And sometimes you can't cope with it. Sometimes you really can't. And when you can't cope with it, it's about stepping away and performing that self-care. I mean, I remember when I was in new grad, one time I worked 7 nights in a row. I mean, not like in a row, but like I worked 7 nights. And each night I had a comfort care patient and they all passed away on my shift. I had to experience 7 deaths and it was just way too much. I just could not take that, and I told my charge nurse, and I said, I cannot take care of another comfort care patient, and please do not assign me anymore. I just had 7 deaths. I can't. And while I love the hospice care and I love the comfort care and I love that portion, when you can only go through so much, and it's knowing that, yeah, this is too much for me right now. I love to come back to it and I love to do it again, but not right now. I need a break. But yeah, it's just knowing yourself and being honest and not saying that, oh, I'm a Superman, I can go through this. Like, no, like accept your vulnerability and accept the fact that you can't do it and voice it out to others so that they can help you.
And I think that taking that step back and sometimes having to detach yourself in a way may be an important tool or skill you need in order to continue in nursing. But my worry is that finding that balance, or that trying to see that fine line between attachment and being needed, from your patients. I think that's one thing that I'm worried about. Like, of course, I want to connect this, and no, I want to, go connect with the patient. I want this bond, but I know that sometimes you need to step back, and there has to be some detachment. But I don't. I'm gonna mix that, like, starting to not care about the patient and being jaded, eventually burning out because of how much I'm trying to perform my duties as a nurse.
Yeah, I think that's a very good concern. And, um, as when I started as a new grad too, all the nurses, my clinical nurse specialists, it's funny that they told me that, oh, your fairy dust is gonna run out, and you're gonna start to see the real world, and you no longer want to like do all this stuff. Blah. But here I am, 4 years into my career now, and I still really, really enjoy the bedside nursing. I mean, I know I'm a manager now, but I help out my nurses on the floor, and I still enjoy doing that piece. I still enjoy speaking to my patients. And, the other day I actually had to take a patient assignment because we were a little bit short staffed. And I gave off report to my night shift nurse. And I told my patient, I said, oh, I'm leaving you in good hands tonight with my night shift nurse. She's great. And the patient looks at me and says, well, I felt like I was in pretty good hands already. Right. And to hear that from like a patient, especially knowing that you haven't done patient care in a long time, and to hear that from somebody, it just brings you ultimate joy. Right. And it's little moments like that, and like capturing those moments and remembering, like, yeah, like, this is what I enjoy about nursing. I really, really, really enjoy that part, and to try to like kind of replicate it and to take care of your patients as if they were your own family members. That's kind of how you, um, in my mind, that's kind of how you keep yourself from becoming jaded or becoming burned out, because you start to appreciate that parts of nursing. Sure, you're going to have those days and nights where you go in and you get a really, unappreciative patient who yells at you all the time, right? But you also have those patients who super appreciate you, are incredibly nice, and tell you that you're doing a great job. And you also have your coworkers who are always going to back you up. You have your family members who are going to back you up and tell you that you're doing a great job, and your friends and everything, right? And so, yes, you're going to burn out. I'm not going to say you're not going to burn out, but how do you fight that burnout with self-care? That's what's important. And to understand that and to know that, that's how you fight that burnout. And that's how you prevent yourself from being jaded.
And when you transitioned hospice did you go straight from hospice care into management?
Yeah, so I guess to speak a little bit about my career, I guess basically, I started in general medicine as a new grad, and my floor in general medicine happened to have hospice care. So I actually got to experience hospice and general medicine. And from there, and when I say general medicine, we're talking medicine patients, so pulmonary issues, renal issues, gastrointestinal issues, as well as any other overflow that we get, so surgical overflow, cardiac overflow, oncology overflow. So, when it comes to service lines and nursing, I've pretty much seen everything. And so from there, from general medicine, I became an assistant patient care manager for another medicine floor. And actually now in this process, currently, we're transitioning our medicine floor to turn into an oncology floor. So I've done a lot, I've seen a lot, and especially as a clinical instructor as well, I've also seen a lot of different service lines as well. But yeah.
And do you what was that thought process of like leaving bedside nursing to go into management? Was that like a hard decision, or was that like always the next step for you? Maybe because it because of burnout, because of what you through hospice?
Yeah, well, Ryan, like, leaving the bedside was the hardest decision I've made in my life. I still miss it to this day, and I will tell you that I have thoughts of going back to the bedside still. When I started my nursing career, I never wanted to be a manager. And when after about a few years, my coworkers kept telling me to go into a management position. I still did not want to be a manager. And I guess to be honest with you, when I applied to be a manager, I still did not want to be a manager. But I got the position and I had to take it since I got the position. And my mentality is, even if I don't want to be a manager, I'm in this position, so I got to give my 150% and I got to do it all and I got to do a good job, right? And so, but for me, the reason why I became a manager isn't because of burnout or because I hated bedside. I still enjoy the bedside portion. The reason I became a manager is because I love, like I told you, I love teaching and I love helping people. And I love helping patients as well. And for me, my biggest thing is I want to create a difference in this world. I want to create a positive, I want to leave a positive kind of legacy, I guess, right? And so for me, when it comes to teaching nursing students or when it comes to being a manager, my thought process is that if I help one person become a good nurse, that nurse helps so many other people out there in the world, right? And so as a manager, I wanted to be the resource and I wanted to help my coworkers. And as a floor nurse, I was a charge nurse, I was in shared leadership, and I was able to make a difference for my coworkers and help them, when they needed help. But I never felt like I had the proper resources to help them in the way that I wanted to. And I knew that when I became a manager, I would have access to more resources. I would have access to higher ups. I would, have a greater voice than I do as a floor nurse. And so that's why I stepped into management, and just so that I can really be there for my staff members, because they were asking me questions that a manager could answer, but I, as a floor nurse, was not able to answer it. But now they're still asking me the questions, but at least this time I have the answers, and I'm able to make the difference that I'm able to as a manager, as opposed to when I'm on the floor.
And would you ever consider, like, once you go into management, is that like a field where an area where the only way is up? Like, is there like no going back for you in terms of like bed nursing, or?
Yeah, so that's a good question. And I'm not going to say that that's it, but it really depends on where you want to take your career. Like, so I guess when I made the decision to become a manager, I was deciding between two things. One, either to go into education and teach, or the other would be to go into management. If I went into education, obviously I would go back to school. I would become a full-time professor and work maybe part-time as a nurse. But now that I'm a manager, I can still go back and get my degree. It's not absolutely required. But now as an assistant manager, my path would be to become a manager and then to become a director. And I guess down the line, become a chief nursing officer or a CEO of a hospital. That being said, that all of that seems a little bit daunting to me, and at this point I'm not ready to step into that. So I'm okay with being an assistant manager at this time, and I'm actually okay. There are a lot of people out there who actually have been assistant managers for like 30 years. They're happy with the role. It's middle management. You get to still mingle with the staff as well as be a manager and mingle with the managers as well. But some people really don't enjoy that because you are a middle manager, so you get a beating from the top and you get beatings from the bottom. So at this point, if I wanted to return to the bedside, yes, I could. And what we say in the nursing world is we usually give people about 5 years. If you step away from the bedside for more than 5 years, most managers won't be willing to give you a chance because that's kind of when you start to lose your skills. But within the 5 years, most managers would be willing to give you a chance. It really depends on how far away you are from the bedside. And it really depends on kind of how you do critical thinking wise, as well as kind of the task wise.
Yeah, this is great because like I feel like for my own curiosity, I feel like for others too, because I feel like in nursing school a lot of it is focused on getting to the goal of being a registered nurse, being a bedside nurse. But I feel like there are so many options. Like I'm my nursing, like a lot of people are not exposed to different fields and areas of nursing. Like I think that a lot of people expect that, if I want to do more, I need to go to grad school and get a PhD. But you've done like so much. You haven't gone to grad school yet, right?
No.
Okay, yeah, because I feel like like you're the prime example where just some people might not want to or not financially stable enough to go to grad school or get a PhD. You can do so much with the BSN. Like you have already become a teacher, you've become a clinical instructor, you've become an assistant manager. I feel like there are so many options out there that a lot of people need to know about.
Yeah, and in nursing, actually, a BSN used to be considered actually like a higher level. Like, how when we think of computer science engineers, whatever, right? We think of their bachelor's as like the basic, right? But in nursing, it used to be that associate's degree was actually the most common. Um, and a bachelor's degree was considered a higher level of, like, was considered a higher degree. So that's why as a bachelor's, you're able to do so much. I think with the generations, switching and kind of with the kind of now what we're seeing is the very foundation of nursing becoming a bachelor's, a baccalaureate degree nurse being kind of like the foundation of nursing now. I think we may start to see more of a shift to people required to have their masters to enter management as well as do a lot more. But for right now, I would say I took advantage of the fact that a bachelor's degree is considered that higher level of nursing. But I would definitely encourage everyone to go back to school if they have the opportunity. But like you said, not everyone has the opportunity. Not everyone is financially stable to do that. And so a bachelor's degree is still a very good degree to have. And it's definitely something that everyone can be proud of, stepping out of nursing school with a bachelor's, and they can pretty much go anywhere and be considered a higher degree nurse essentially already with a bachelor's.
And when you talk about recommending some like certain nursing students to go back to school after getting their BSN, do you like? Because I've heard like a lot of talk from both sides. Like, do you think it's better to go straight into like a grad program, or like maybe wait like 2 years, a couple of years, go back to school, or there's even like the 4 months. Like, what are your thoughts?
The literature goes both ways when it comes to that topic. Some people say you should go straight to grad school, and some people say get experience first and then go back to grad school. I think it really depends on what you want to do. I think it really just depends on what you want to do with your degree, as well as kind of which direction you want to take. I would personally, for me, I would recommend getting that experience first and then going back to school, just because the experience helps you kind of figure out what you want to do, as well as it gives you the experience. Because most people who go back to grad school still require that bedside experience to get the job that they want. It's hard to get a nurse practitioner job straight out of school without the bedside experience.
Mhm.
It's hard to be an instructor without that bedside experience, right? So I would always recommend working first, but for some people they don't have that option and they need to go into grad school first, which is fine. But I would say even after going to grad school, get that bedside experience. And when you do decide to go to grad school, like, don't think that you have to go that NP route or the DNP route or the MSN route. There are plenty of other degrees out there that nurses can get that aren't related to nursing. One example I have, honestly, is my current manager. He has his master's, he has an MBA, and he uses that to understand finance and the economics behind healthcare administration. And so he's able to better advocate for us as staff because he's able to speak to our finance department in a language that they understand, and they actually respect him for that. And so you can do that with an MBA. You can honestly go back and get like your law degree and enter risk management or nursing quality, or kind of the nurse lawyer, and basically help with the malpractice suits, or basically kind of enter that department as a nurse. But there's a lot of different degrees out there. You could even go back and get your education, your doctorate in education, right, and then become a nurse educator. So there's a lot of different paths that you can take, but I would say definitely get that experience first, because you don't know what you want to do until you actually do it. And after getting that bedside experience, I think it was a little bit easier for me to find out what I really wanted to do.
But yeah, but in terms of like you said, like a nurse educator, like getting that PhD, but then you were able to, I guess not be a nurse educator, but like you were still able to teach nursing students with a BSN. Like how? Because I feel like that's a lot of. Because when I talk to a couple of my friends, I know a lot of them want to give back to nursing students. They realize all the stuff they went through. Maybe some of their teachers weren't teaching as well, or they weren't, doing as well as they hope for, and they want to eventually come back and try to help nursing students go through this difficult process of nursing school. Like, what's advice for maybe some of the listeners? Like, how do you go from that BSN to like slowly becoming a clinical instructor, or maybe even like nursing 120, something like that? What's the process behind
Yeah,
it?
Yeah, that's a good question. And I get that question a lot too, especially from a lot of my former students who tell me that they want to come back and be a clinical instructor just like me and scare the crap out of all the other nursing students just like I did, right? And you know, it really just boils down in my mind just to kind of your personality, you know. Uh, and I'll be honest, not everyone can be a teacher. There are some great nurses out there. There are some amazing, smart people out there who do not make the best instructors. And it's really, I think, just about kind of understanding that about yourself. And yes, I understand you want to give back to nursing students. Yes, I understand you want to come back and be a teacher. But you know, like you kind of have to realize that about yourself that maybe you're not exactly the best teacher. Maybe you shouldn't go back and do it. And a lot of that can start with being maybe a preceptor first on your floor and kind of noticing that, you know, when you precept students, new grads, or even new hires, are you a good preceptor? Like really, like, and that's where you have to learn to, like I said, learn to be vulnerable and have that conversation and ask them like, hey, am I a good teacher? Because some people will tell you like, oh yeah, you're really great and I learned so much from being with you. And some people will tell you, not really. I think, and you know, it's learning to accept that. And so for me, I think I got pretty lucky because, you know, in my 1 year, so I started teaching nursing 120 a little bit less than a year after I started working. Uh, and nursing 120 is a class that's, in my mind, you don't need that bedside experience to teach. I think if anything, you really need more of that just kind of like common sense, in my opinion, and kind of like a good understanding of like, I guess, like healthcare administration and stuff like that. But, you know, I will, you know, when I taught nursing 120 and even when I taught clinical, I spent days before class, like researching and like learning stuff. And, you know, my sophomore two students will tell you, and actually like Nick Benaria will tell you how much time I spent on preparing for clinical. I got in at 5:30 a.m., sometimes 6 a.m., sometimes looking up all of their students. You know, I had my students tell me like, oh, like um, I pre-labbed on this patient. So I'll get in there in the morning. I will look up all their patients. I will look up all their medications. I will formulate questions for them. When it came to sim, right, I would, the day before, essentially take the whole day to go over those sim scenarios and think about if this, if that, what if this, what if this, create different scenarios for how people react. I would think about which students I want to send in for which scenario. You know, I spent a lot of time preparing. And to me, if you're not willing to spend that time and if you're not willing to put in that time for your students, you really shouldn't be an instructor. And so, you know, I would say get that bedside experience, know what you know. If you feel like you know enough to teach other people, then yes, step into it, be a preceptor, start teaching other people, start teaching your friends, start teaching your, you know, be a mentor, start teaching other people and see if you're good at it. If you are, then yes, step into that role, become a clinical instructor, and you know, from there take the feedback. When I stepped into my first ever clinical, I didn't know if I'd be good at it or not, but I knew that I would work my butt off to make sure that my students learned something. And when my students gave me that feedback saying, oh yeah, you're a good clinical instructor, you should keep doing it, and I said, okay, that's when I said I would continue doing it. But if your students tell you you're kind of a crap clinical instructor, take the feedback, know what you did wrong, and then learn from it. And then basically, uh, that's how you become better. It's just like nursing, right? You take the feedback and that you become better at it by taking feedback from others and by practicing. So
And I think that goes back to, you know, understanding yourself, right? Really taking that time. And I think USF, we've been fortunate to really have that opportunity through classes like, you know, Nursing 120 or even Death and Dying, and just the conversations that we have throughout our 4 years that really reinforce, you know, that self-reflection, self-evaluation, and thinking about, you know, the debrief process, right? We spend so much time talking about that, and so it's like in moving into that instructor role, and it's not just instructing, it's also mentoring as well and guiding people. You know, you can't really do that until you understand yourself, your capabilities, your limitations, and your style of how you do things and what your goal is for your students. And once you can understand that, then you have to take time to not only understand yourself in that new role, but also understand, you know, your students, you know, their strengths, their weaknesses, their goals, and where they're trying to go. And then also understanding what you guys are even doing, right? Whether it's sim or clinicals, their patients, etc.
Right, exactly. And it's really, like you said, it'll be like getting to know yourself. And, you know, I had a director who told me that you don't know what you don't know, right? But I know what you don't know because I'm in a higher position than you, and I've stepped into that. I've been in that position for a long time, right? And so I took that message to heart, actually, and I started seeking out mentors. I started seeking out people who have been in those positions, and I've asked them questions like, "Hey, what do you think about this? What do you think about that? Do you think I should do this? What do you think about me?" Sort of thing. And they're able to tell me things about myself that I did not know about myself. And so in nursing school, you know, it's kind of, if you know that you want to be a teacher, if you know that you want to be an educator, it's about finding the mentors to really ask them like, hey, what do you think about me? Do you think I could be an educator? And so when I was teaching junior twos, right, your semester, Toby, um, every single clinical student that I had a sit down conversation with them, and I said, what do you want to do? And really think about, what do you want to do? And some students will tell me certain things, and I will tell them, I'm going to tell you right now, your personality will not fit that role. You should step into this, look into this. And I've had some students tell me, oh yeah, you're right, I actually think I would enjoy this. And I have some students tell me, no, you're wrong, I'm going to prove you wrong. And that's fine. If you're going to prove me wrong, do it. You know, like, and I would be right there for you, congratulating you, telling me, yeah, you proved me wrong and you're doing that great. But at least you thought about it, and at least I feel some fire in you to make sure that you're able to do it. Right. And so finding those mentors and finding the people who can help you, like for me, that was Dr. Denatale, who I had a mentor, and Dr. Hurley, and I spoke to them about teaching, and they told me, well, you know, it really takes kind of like this type of person and everything to do that. And so I kind of helped myself become into that role and kind of envision myself, am I able to do this? And then yes, I found that I am able to do this. And then basically what I do when I teach now is I think about the previous instructors that I've had. I think about my previous clinical instructors. I think about my previous professors. And I think about, what did I enjoy about them? And what did I not like about them? Right? And so the things that I did enjoy, I continue to do. And the things that I did not enjoy, I definitely make sure I don't act like that at all. But yeah, like you said, it's about learning about yourself and also learning from others and taking feedback, and having the mentors tell you that, yes, you can do it, but you just have to do this. Or having the mentors tell you, no, you can't do that because of X, Y, and Z, and then fixing yourself from the feedback that you received.
I think that's definitely something I grabbed a lot from you from our first interactions. Yeah, so that was something you mentioned before, is finding people to draw from, people who've been there, people who have a better understanding of you in areas that you didn't even know existed before, and then taking that deep dive. And so the people that I've talked to who have gone through this program or are still in this program, the people that I've seen who have really gotten so much out of it, I think have been the people who have really taken the time to talk to the instructor. We have so many great resources in our program. You know, Dr. Danatale, Dr. Hurley, and countless more. You know, every single semester, there's just a wealth of knowledge, and it's there if you want to, but you have to tap into it. You know, those people aren't going to just hand you everything because everything's different. They can't. They're not just regurgitating the same stuff. It's specifically tailored to each person. And I've definitely seen people who have been, you know, in a position where they maybe were struggling with their path or what they wanted out of nursing, and then having those few conversations with, you know, maybe just one person in the nursing program, maybe two people, or maybe a collection of people, but having those conversations for them, whether it was guiding them onto the right path or fueling the fire for them to have more passion for what they were initially trying to set out to do in nursing, but then, you know, along the way sort of lost it through this or that. And then all of these people have become so much more successful than where they were prior to really forming these relationships in the program.
I feel like that's what MSNS is trying to do. Like, we're not like saying that we are the source, but I think that MSNS is doing a good job of helping, especially the underclassmen, the freshmen, finding resources. You know, we're not, you know, we're not the expert, we're not the resource, but we have enough experience where we can, the freshmen and underclassmen, anybody really, to a mentor, to a guide that can help them figure out your passion in nursing?
Yeah, I think MSNS does a great job of that for sure. I think if anything, I'm glad the direction that Shane took the club. And when we had a conversation about MSNS, and Shane told me that, I think of MSNS as kind of like a social club, and in a way that everyone can get together, and this is the time that we can bond together as nursing students and learn from each other. And I said that's a great idea. And I think that's a philosophy that basically every nursing club should take. But I understand it can be difficult for a nursing student association to do that just because of their size. And so for MSNS to really take the lead on that, for all nursing students, not just, and I've got to kind of call out Trigamma here for basically being a female-only club. But with MSNS, it's all-inclusive, and it's everybody comes together, and everyone's able to really feel that bond that like a nursing unit would be able to. I think it was definitely a great idea. And if anything, for me too, I think people are happy to mentor people, especially if they're able to kind of share that knowledge. And I used to be of the mindset that, I don't need a mentor and I don't want to mentor other people. But after kind of stepping into the real world, I realized, I do need a mentor, and I do need that person to help guide me. And if anything, like, you start to meet people who really kind of start to admire what you do and kind of what you bring to the table, and they say like, I want to be your mentee. And then you realize, you look at them and you say like, you remind me of me when I was younger. And then that's when that's kind of when you take them on as mentees and you help guide them. And I think if anything, it's what helps us become stronger as a profession as well as people, because now you're able to help other people get through the bumps that you had to kind of experience, but you help them get through those bumps, and then they get even further than you do because now they have your knowledge as well as their own. So I think it's a great thing to do. And I think if anything, for sure, for all the listeners out there too, definitely, if you have somebody that you kind of admire and you definitely want to be more like, ask them to be, their mentee, and ask them for guidance for sure, because I'm sure they'd be willing to help you as well.
Yeah, I think that's one of the beautiful things about USF and just mentoring in general, like having been on both ends, with kind of funny how we're all on this call where you kind of, you were a huge inspiration for me in prior to the junior 2 semester, but also through that junior 2 semester and afterwards, seeing, and I talked to Dr. Denali about this all the time, and she was always just like, look at what Soo Young's doing. Like, you're going to do that too. And I'm like, well, I'm not going to do the exact thing, but yeah, he's kind of on the similar path that I had considered, or eventually kind of saw myself touching some of the areas that you had touched with, teaching and management. And like, these are things I've always been curious about, but here I get to see someone who has similar values to how I approach nursing, and here's how he's done it. And then evaluating like, okay, I wouldn't necessarily do it exactly that way, but here's some cool things that you're doing, and those are themes that I want to incorporate as I consider these paths. And then also, with Ryan being my intern / mentee through the past year, and then being on the other side where initially Shane approached me, he's like, hey, he doesn't necessarily want to be an officer, but can he be an intern? And I was kind of like, okay, sure. And, I was like, I don't really know what I can bring to the table. But then also through this whole process, like, I think I learned just as much as Ryan did through this relationship. And it kind of surprised me, because usually when you think of a mentor-mentee relationship, you kind of think of the mentor as just, helping guide the mentee, but then in a lot of ways, I think the mentee also guides the mentor. So it's a really nice relationship where you get just as much out as you're putting in.
Yeah, and Toby, like, be honest with me, Ryan can be kind of a pain in the ass sometimes, right?
I've had the total opposite. Honestly, like, there's so many things where I'm like, hey, Ryan, what do you want to do? And I just kind of leave it up to him.
Yeah, but like, I meant like having a mentee, just having somebody there can be kind of a pain in the ass sometimes.
Sometimes, I mean, it's an extra person you have to worry about sometimes, right? And then I think the bigger pain is sometimes you forget. You're like, oh shoot, like, Ryan's there. That's right. I have to think about Ryan now. Okay, yeah. What do we do? But that's kind of part of it, right? Like, learning. Oh, okay. So here's where maybe I didn't do as good of a job of mentoring, and maybe I dropped the ball. Or sometimes, okay, I haven't heard from him in like about a week, and we have some things that we're supposed to take care of. Like, what happened, Ryan? Where are you? This is kind of the human side of things, right? Like, you're not perfect, but it's all about working in that relationship and thinking, okay, what's our ultimate goal? Looking more long term in the macro rather than in the micro of every week of, okay, this week didn't go as well, or like not worrying too much about that.
Yeah, and that's not to take a shot at you, Ryan. I just meant it as like, you know, like having a mentee. Honestly, it can be a pain in the ass. Like, you know, shout out to Nick and Amy who were my mentees, but you know, it really it really sucks sometimes knowing that, oh man, you got these two people who you tell them that, oh, you can text me or email me or call me anytime, and they really do. And you know, like, and I don't mind because it's them, and like, you know, you took that responsibility, and I really enjoy having their presence. I really enjoy like kind of guiding them and mentoring them. But sometimes, man, you're just like, you're in the middle of a nice dinner and then someone texts you saying like, I need help, and you're like, God dang it, like right now. But you know, at the end of the day, and like I'm sure you've experienced this already too, Toby, but like when you see like your mentees like grow and like really become the person that like you look at them and you say like, wow, like they started as like an egg, and now
Yeah.
they're, you know, now there's somebody incredible, and
Mhm.
there's somebody who's capable of doing so much more than you. You just look at them and you say like, dang, I'm proud of that, and I'm glad that I went through all those experiences, and honestly all the bad things, all the good things, you know, glad to experience all that with them, and to see them grow like that, it's really like, it's really inspiring, and I think it helps you become a better person, like you said too. So yeah.
Yeah, it definitely, it's a huge motivation. Like I can say for like 100% fact that what like things that Ryan's achieving right now are things I'm like, damn, I was not doing these things when I was a sophomore entering junior year, and like these are all the things that like I had considered and thought about, but I never really made that jump. And then here I am seeing someone who's really making those jumps. I'm like, damn, that's inspiring, because now I get to take that and go, okay, well I didn't do that, you know, a year ago or 2 years ago, but now the next time I encounter a situation where if I could look back 2 years later from it, what would I have wanted myself to do? And then really making those jumps and doing those things, and not, you know, making excuses because I'm like, okay, well here's a guy who in my same position, here's what he did, and here compared to what I did, like I can do that now, or at least make the attempt to do that.
I feel like
Right.
that's so great about like the mentorship program, and just having interns or just having someone to look up to. Because I feel like sometimes when you're in a state of like complacency, it's really hard to motivate yourself to push because you don't really know where your ceiling is. You don't know where the boundary is. But I think once you kind of find that role model where you see like, oh, I could, you know, like the ceiling is endless, like the boundaries are endless. I can continue pushing myself to become bigger and better. Because I think one thing that I always stand by is I want to be the. You know, when I say when I want to be the best, it's not like I don't want to. It's not like I don't want to be the best compared to other people. I want to be the best that I can. If I feel like I have like greater potential or something, I want to do my best to reach that potential. But sometimes you can't really acknowledge, realize your potential until someone else comes by and helps give you that push. And MSNS, I feel like, is an amazing place where you can find those people, surround yourself with those people, those like-minded people that are very ambitious, and passionate about what they do. And I think that passion is just so infectious. And through their experience, through their leadership, I feel like I've been able to push myself and, you know, grow as a result of, you know, everybody like you, especially you, Toby.
All right, that's fantastic.
Yeah, I guess in closing, like if there was maybe a few things that you would think, you know, things maybe you would have wished you would have known, or just things you've learned now, you know, 4 years into your career, and thinking back to, you know, 8 years ago at the start of nursing school, and then 4 years ago at the end of nursing school, like what are some things that you have context now that you feel like would be helpful to anyone who's, you know, still in nursing school, or even we have some people who aren't even in the nursing field at all, you know, that could benefit from?
Sure. Well, let's definitely start with, you know, I guess what I would tell myself 8 years ago before I entered nursing school, right? Um, really have your heart set on being a nurse. And when I say that, I mean, don't go into nursing just because of money or because your parents tell you to or whatever. You know, become a nurse. You know, go into nursing school if you really want to be a nurse. And when I say be a nurse, I mean take care of other people. because at the end of the day, the basis of nursing is caring for other people. Don't think that nursing is just a cush job where you just sit around and do nothing but chart. But the very basics of nursing is caring for a human being, the bed baths, the feedings, the talking to them. That's the very basis of nursing. So if you want to go into nursing to actually take care of people, then go into nursing. But if you want to go into nursing just for the money, it is not the profession for you, and I can guarantee you that you're going to burn out real fast. So have your heart really set on nursing, and really understand that nursing is an amazing profession, and you really will get personal fulfillment out of it, and you'll really enjoy it if that's something that you truly enjoy doing, right? And then what I would tell myself before I graduated nursing school, for sure, and probably as a recent graduate, I would say, calm down, just relax, don't be nervous. Everything will be fine, Toby. You'll find a job. Everything will work out.
We're all crying.
Yeah. I know it's stressful right now, and I know it seems like everything is tough, but at the end of the day, everything's going to be fine. And what I told myself when I failed my first HESI, it's all going to be okay. What's the end of is like, what's the worst thing that's going to happen if I fail the HESI again? Oh, I have to take it again. What's the worst thing that's going to happen if I fail again? Oh, I have to take it again. And sure, I might delay my graduation, but at the end of the day, I still have my arms and legs. I still have my brain. I can still eat every day. I have a roof over my house. I have food on the table. I have all these things. Everything will be fine. It'll all work out. I promise you, it'll all work out. And sure, you might have to move away from the Bay Area or California or wherever, and you might not want to, but in a year or two, you'll be able to come back. People will be begging for you to come back. All right. And I guarantee you, when you start working, a year goes by really fast. I mean, I used to be 21 at a certain point. And God, I'm already 25, turning 26. I'm getting old, man. I can't even drink like I used to. Like, it sucks, right? But it'll go by fast. Everything will be fine. And then I would say once you start to, start working, really enjoy it. Definitely take the time to really be grateful for the opportunity that you have, and be grateful for the coworkers that you have, and your preceptors, your mentors, your managers. Be grateful for all of it, and definitely, even the fact that you have a job, just be grateful for it, and really go out there and have a positive attitude and accept the things that happen, and really be happy for yourself as well as for your family and everything, because you really accomplished a great deal by getting your first job. And then I would say, really, for just anyone out there who is interested in being a nurse, or is kind of just having like a tough time, right, but just kind of like we talked about today in our podcast, right, is kind of really appreciate everything, right? Appreciate the little things, appreciate the big things, but just have a greater appreciation for everything, and just be happy for everything that happened. And if you're going through a tough time right now, I guarantee you it happens for a reason, and there really are brighter days ahead. So, yeah.
Thank you so much. That was thank you for coming on to the podcast. We really appreciate it.
Yeah, of course. And yeah, if you need me for anything, if you guys need me for anything, just let me know. But I'm probably gonna hop off now. Okay.
All right.
Thank you so much.
All right. Take care.